Concerned about overeating, what's food addiction and how to get over it? There are many factors that can cause overeating. An abundance of fast food, junk food advertisements, and the delicacy of many processed foods can make you feel hungry. People who experience an addictive diet may have intense cravings, which have nothing to do with hunger, as well as increased levels of food intolerance and feelings of withdrawal. For many of us, eating certain foods can be comforting, pickups while working hard, rewards after working all day, a satisfying end to a beautiful dinner. But some people have a compulsive and uncontrollable desire to eat certain foods, especially the most delicious junk foods. This can affect their daily routine and their ability to carry out social, work or family roles. People who experience an addictive diet may have intense cravings, which have nothing to do with hunger, as well as increased levels of food intolerance and feelings of withdrawal. Instead of starving, these cravings can be triggered by low mood, mental illness, depression and anxiety, high levels of stress or increased emotions. Food addiction or addictive eating is not yet a disorder that can be diagnosed in a clinical setting. Yet patients often ask health professionals how to manage their addictive diet. These healthcare providers generally acknowledge the addictive eating behavior of their patients but are not sure about proper treatment. Food addiction is commonly assessed using the Yale Food Addiction Scale. The science of addictive eating is still emerging, but researchers are increasingly realizing that the addictive and reward pathways in the brain are related to the desire to overeat due to stress, increased emotion, and mental illness. How common is this? There are many factors that can cause overeating. An abundance of fast food, junk food advertisements, and the delicacy of many processed foods can make you feel hungry. However, some people complain that they do not have control over their eating, do not like it and do not want it, and seek help for it. About 1 in 6 people, 15 to 20%, report addictive eating habits or addictive behaviors around food. While the prevalence of food addiction is high in people with obesity and mental health conditions, it affects the subset of these groups. How can you tell if you have a problem? In general, food addiction is caused by foods that are highly palatable, processed, and high in energy, fat, salt, or sugar, and have low nutritional value. These can include chocolates, confectionery, takeaway foods and baked goods. These foods can be associated with a high level of reward and can make you anxious. They can boost your mood or distract you from anxious or distressing thoughts, and over time, you may need to eat more to get the same feeling of reward. For others, however, it may be an addiction to feelings of perfection or feelings of reward or satisfaction. There is a constant debate about whether the food components are addictive or whether the eating behavior itself is addictive or a combination of the two. People eat food for different reasons and people may form habits around certain foods. This may be different for different people. Through our research, which explores the experiences of adults, we find that many people with food addiction attribute their behavior to childhood experiences. These events are very diverse. They range from traumatic events, to the use of dietary or restrictive eating habits, or to poor body image or body dissatisfaction. Our latest research found addictive eating in teenage years is associated with poorer quality of life and lower self-esteem, and it appears to increase in severity over time. Children and adolescents have less addictive eating behaviors or symptoms than adults. Of the 11 symptoms of the Yale Food Addiction Scale, children and adolescents usually have only 2 or 3, while adults usually have 6 or more, which are classified as severe food addiction. The associations we see in adolescents also appear in adults. Increased weight and poor mental health are associated with a greater number of symptoms in the spread of food addiction. It highlights that some adolescents will need mental health, eating disorders and obesity services in a combined treatment regimen. We also need to identify early risk factors to enable targeted, preventive interventions in young age groups. How is it treated? The root causes of addictive eating are so diverse that not all treatments are the same. A wide range of treatments are being tested. These include passive approaches such as self-help support groups, trials of drugs such as naltrexone and bupropion, which target the hormones involved in appetite and work to reduce energy intake, bariatric surgery to help with weight loss. The most common procedure in Australia is gastric bonding, where an adjustable band is applied around the upper abdomen to apply pressure and reduce appetite. However, some available self-help groups include the participation or input of qualified health professionals. While providing peer support, these may not be based on the best available evidence. Some evaluation is done for effectiveness. Medications and bariatric surgery involve health professional input and have been shown to be effective in reducing weight and reducing the symptoms of food addiction in some people. However, this may not be appropriate for some people, such as those in a healthy weight range or with complex underlying health conditions. It is also important to note that people taking medication and surgery are advised to make dietary and other lifestyle changes. Other holistic, individualized lifestyle approaches, including diet, physical activity as well as mindfulness, show promising results, especially when co-designed with consumers and health professionals. Our emerging treatment program. We are also developing a new holistic approach to managing an addiction-free diet. We recently tested an online intervention designed for individual personality. Based on behavioral change research provided by dietitians, test participants received personalized feedback on their addictive eating habits, diet, physical activity and sleep symptoms and the goals they set, distraction lists, and plans that contribute to the overall action plan. 3 months later, participants reported the event as acceptable and feasible. The next step in our research is to test the treatment for efficacy. We are conducting a research trial to determine the effectiveness of treatment on reducing the symptoms of food addiction and improving mental health. This is the first study of its kind and will be translated into clinical practice if found to be effective. The authors are at the University of Newcastle. This article is syndicated by PTI from The Conversation.